Hello, everyone. My name is Abhinav Jha. I'm a faculty here in the Department of Biomedical Engineering and the Mallinckrodt Institute of Radiology at Washington University in St. Louis. And I'm here to talk about one of our recently published papers in PET Clinics Journal titled Objective Task-Based Evaluation of Quantitative Medical Imaging Methods, Emerging Frameworks and Future Directions. With me to talk about this paper are Yan Liu and Huitian Xia. They are both PhD students at Washington University. As you can see from the list of authors on this paper, this was a multi-institutional effort with authors from the Cleveland Clinic as well as from University of British Columbia. So let's get started. So quantitative imaging, as most of you may already know, it's a procedure to extract numerical or statistical features from medical images and use these for clinical decision making. Now, there's a lot of excitement about quantitative imaging. There are several examples of this, such as determining metabolic tumor volume by PET to predict cancer therapy response, quantifying dopamine transport uptake by SPECT to assess severity of Parkinson's disease, and quantifying intratumor heterogeneity by CT to predict treatment outcome. Now, given all this excitement surrounding quantitative imaging, multiple new quantitative imaging methods are being developed. This include things like new reconstruction methods, new segmentation methods, even new systems. And so there is an important need to be able to evaluate these methods based on their performance in clinical tasks. Now, for this purpose, multiple evaluation methodologies are being developed. And in this article, our goal was to survey the literature and, sort of based upon our survey of the literature, we identified some emerging evaluation frameworks that we have presented in our paper and that we will be briefly talking about today. These include the frameworks of virtual imaging trial, the framework of evaluating these quantitative imaging or QI methods, as we refer to them, without ground truth, evaluation for joint detection and quantification tasks, and evaluation of QI methods that produce multidimensional features, such as radiomic features. The first emerging framework that we will be talking about is virtual imaging trials, and Huitian Xia will be talking to us about that.
Yeah. So in an idealistic setting, quantitative imaging methods should be evaluated clinically with patient data. However, this poses multiple challenges, including high financial cost, difficulty in recruiting target patient population, increased time requirement, ethical concerns, as well as a lack of ground truth for comparison. So given these challenges, mechanisms are needed to identify promising quantitative imaging methods prior to the clinical evaluation. The emerging paradigm of virtual imaging trials is showing promise in fulfilling this role. Virtual imaging trials present a cost-effective, safe, and feasible evaluation approach to identify promising QI methods with realistic modeling of patient anatomy, patient physiology, PET imaging process, as well as techniques for doing quantifications. Specifically, we discuss about proper figure of merits that can be used in different contexts. As for the details, we refer the audience to read through the first section of this paper.
Thank you, Vidya. Next, we will be talking about a very intriguing topic. How do we evaluate quantitative image methods when we do not have ground truth? Yan Liu will be talking to us about this topic.
Yeah. So for clinical translation of the QI methods, evaluation with patient data is important. For example, here consider we are evaluating 3 segmentation methods for quantifying the metabolic tumor volume using patient data. So in this case, we don't have any ground truth to compare with as we have this in the virtual imaging trial. A potential gold standard we could consider is the resected tumor. However, obtaining such data for patient population is almost impossible. So to address this, a class of regression without truth techniques has been developed. These methods assume that the merit and true values are linearly related, and also that the true values are sampled from a parametric distribution. Based on these assumptions, these methods can estimate the linear relationship parameters without access to the true values. From these parameters, a figure of merit can be derived to compare the methods based on precision. So here is a framework for evaluating QI methods using these techniques. In the first step, we check whether there is a linear relationship between merit and true values. And then if such relationship exists, we can apply the regression without truth techniques. And then we can perform consistency checks to help us flag potential errors. And finally, we can provide the rankings of the QI methods.
Thank you, Yan. And again, for more details, we would refer the audience to the paper itself. Next, we would like to talk about evaluation for joint detection and quantification tasks, and Huitian will be elaborating on this.
Yeah. So in the clinic, performing any quantification task typically requires a detection step. For example, as shown in this figure, to quantify tumor volume or total uptake from this PET image, the first step is for a physician to visually interpret the images to detect lesions. Thus, for more comprehensive evaluation of QI methods that requires a prior detection step, strategies to evaluate these methods on joint detection and quantification tasks are needed. Based on the prior studies on evaluation techniques for such joint task, here we outline a framework to perform such evaluations. So here we also provided an example of a human observer that detects the tumor and quantifies the tumor through delineation. Based on a statistic given by the observer, an estimation ROC curve can be built as a figure of merit for evaluation. Additionally, we have also discussed about existing mathematical observers that can be used when human observers are unavailable. For the specific information of these mathematical observers, I refer the audience to read through this chapter.
Thank you, Huitian. And so finally, we'll talk about evaluation of QI methods that produce multidimensional features, such as methods that are used to estimate radiomic features. Yan will be talking to us about that.
Yeah, sure. For example, here we are evaluating some texture radiomic features such as correlation, contrast, entropy, and so on. So in this case, we are evaluating, before we quantify those features, we need to bin the images. And in this case, different numbers of bins could be used. Now we maybe want to know which method performs the best. In this case, the strategies in the context of quantifying single feature may not be sufficient because it is possible that one method could be more precise for quantifying some of the radium features, while another binning method can be more precise for the remaining radium features. So this makes direct comparison difficult. Since the goal of using these multidimensional features is usually to make clinical decisions, one approach is to assess the performance of these QI methods on making such decisions. A possible framework could be the following, in the first step, we define the clinical task such as diagnosis, whether it's used for cancer staging or prognosis, such as prognosticating overall survival, or prediction, such as predicting treatment response. And then we select the study type, such as retrospective, prospective, real-world evaluation, based on the risk and data availability. In the third step, we need to collect representative, unbiased test data, and we need to ensure that there's no overlap between the test data and the training or validation data. We can use the power analysis to determine the required sample size. So then we need to define the reference standard to compare with. Biopsy pathology, expert panels, and overall survival can be used to depending on the clinical task. Finally, we need to select the figure of merit depending on the clinical task to compare the QI methods.
Thank you, Yan. So the key takeaway points from this paper would be that clinical translation of quantitative imaging methods require objective evaluation of these methods on clinical tasks. And in this paper, we have tried to outline 4 emerging frameworks to perform such evaluation. Now, clearly, this is a very exciting area of research, and there is a lot more happening in this field. In this paper, our goal was sort of to outline these 4 emerging frameworks, but there are several other research activities that are happening. We discussed some of these in the discussion section. So for more details, we again refer the audience to our recently published paper in the Pet Clinics Journal. We provide the PubMed ID here, and if you're interested, we have the QR code, which you can scan to get access to the paper. So with that, we'd like to thank you for your attention. I'd also like to thank our co-authors, and we would like to thank also Dr. Kyle Myers, Dr. Paul Seegers, Dr. Ehsan Abadi, and Dr. Gabo Wong for helpful discussions on this manuscript. And yeah, if you have any questions, please feel free to reach out. Yan has provided her email ID there. Feel free to reach out to Yan, as well as, if you go to our website, then you will find the email IDs of Huitian as well as my own email ID too. So with that, once again, thank you so much for your attention, and looking forward to hearing from you if you have any questions. Thanks.